With respiratory acidosis, acidosis refers to a process that lowers blood pH below 7.35. And respiratory refers to the fact that it's a failure of the respiratory system carrying out its normal pH balancing job. Now, normally during an inhalation, the diaphragm and chest wall muscles contract to pull open the chest, and that sucks in air like a vacuum cleaner. Then, during an exhalation, the muscles relax, allowing the elastin in the lungs to recoil, pulling the lungs back to their normal size and pushing that air out. Ultimately, the lungs need to pull oxygen into the body and get rid of carbon dioxide. Carbon dioxide binds to water in the blood and forms carbonic acid, which then dissociates into hydrogen ions and bicarbonate ions. So, in order to prevent pH fluctuations, the carbon dioxide concentration, or the partial pressure of carbon dioxide, called PCO2, needs to be kept within a fairly narrow range. For this reason, the lungs maintain the ventilation rate they need to get rid of carbon dioxide, at the same rate that it's created by the tissues. If PCO2 starts to rise and pH starts to fall, chemoreceptors that are found in the walls of the carotid arteries and in the wall of the aortic arch start to fire more. And that notifies the respiratory centers in the brainstem that they need to increase the respiratory rate and the depth of breathing. As the respiratory rate and the depth of each breath increases, the minute ventilation increases. And that's the volume of air that moves in and out of the lungs in a minute. The increased ventilation helps move more carbon dioxide out of the body, which reduces the PCO2 in the body and raises the pH. In respiratory acidosis, the normal mechanism of ventilation is disturbed, and minute ventilation becomes inadequate to balance the pH. This can be due to a number of problems. Sometimes the problem's not in the lungs themselves, but in the respiratory centers of the brainstem. After a stroke or a medication overdose, like with opioids or barbiturates, the respiratory centers can slow their rate of firing, so breathing becomes extremely slow or stops entirely. It could also be due to a neuromuscular disorder, like myasthenia gravis, where the nerves don't effectively stimulate the muscles to contract. Sometimes the diaphragm or chest wall muscles don't work properly, which can happen after severe trauma, or due to obesity when the chest wall is too heavy for the muscles to lift it. Another reason is airway obstruction, which might happen if a child swallows an object like a peanut and it lodges in the right mainstem bronchus, preventing the lung from fully ventilating. Finally, there might be impaired gas exchange between the alveoli and the capillaries.